Imagine if we had a world where we took away all influencers that are like trying to scare people, and then they end up making them buy these crazy supplements or just go on these crazy plans or don't trust the doctor. Imagine if we got rid of all of them. Imagine if we got rid of all of them and then just said,
man.
"Oh, hey, here's what's going on. This is my opinion, but it's based off of what the evidence says. This isn't like an anecdotal thing of I saw this one person, I had this one experience." Like, we put that information out to the world, allow the world to consume it, and I would be surprised if we don't start making some better choices.
Yeah.
So how do we do that? Is we need to empower the qualified professionals to start putting their message out there and not being scared to do it.
Alrighty, thanks everyone for tuning in to this episode of Find Your Cause. Today we have Dr. Spencer Lalk, who's the founder of MedStory Studio. Dr. Spencer, thank you so much for your time on a Monday night.
Happy to be here, Joseph.
So as always, we like to start with the mission of the organizations of the founders a lot of times we interview. So what is the mission of MedStory Studio?
Yeah, so we are creating the world's largest network of medical storytellers. Basically, the goal is to help get people the right information at the right time so that they can make the best decision for their health.
All right. I'm going to dive into that and ask you a lot of questions. But before I do, why you? Why is this something that you've taken up the torch for?
There's multiple stories that have led to the founding of MedStory, but probably my favorite story is when I got a call from my mom. I was actually in Colombia learning Spanish, and I got a call from her, and she told me that she was experiencing some shortness of breath, some heart palpitations, and I could tell she was super scared. And I remember the sound of her voice and thinking, I got to be there for her during this time, because she had a cardiologist appointment set up, but she had no one to go with her. And so I was like, you know what? This is my mom. This is the most important woman in my life. I will drop anything for her. So get off the phone. I tell my girlfriend, I was like, I got to go back. So get on a plane from Colombia to New Jersey the next day, get there to my mom. Luckily, we get in to see the cardiologist, I think a day or two later. And I could tell we were in the waiting room. She was waiting anxiously, because whenever you're suffering from a condition, really it's that waiting time from being like, something's wrong with me, to what's going on with me and I need to have a solution. And so it's like really can be a really relieving process when you finally get to see the doctor. So they finally call us back. We get in there to see the cardiologist, and this woman comes into the room, and my mom starts to explain what's going on with her. And before she could finish explaining what was going on, the doctor had to cut her off and say, okay, you know what? Based on what I'm seeing off of your lab results and what you're telling me, here's what I think is going on. We're going to put you on this medication, and we're going to order these other lab tests for you. And me, as the healthcare provider, I'm a physical therapist by trade. I understood what she was saying, and it all made sense logically. And so she asked my mom, she's like, okay, how does that sound? Are you okay with that game plan? And my mom's shaking her head yes the whole time. Yeah, this sounds great. Okay, let's do it. And before we could say another word, she was out the door. I think we got about 10 minutes with her. And I get into the car with her, and I'll never forget this, that I look at her and I say, so what do you think? Like, how do you feel about this game plan? And she looks at me and she goes, I'm not really sure what's going on. She didn't truly understand it. And it was at this point where I realized, like, this is a big problem. This woman had been scared for her life, finally getting to see the world's very highly qualified professional that can give her the answers, and yet she left more confused than before. And honestly, it's not the fault of the doctor. It's because she's in a healthcare system where she has to see 30 to 40 patients in a day, right? So she doesn't have the time. And so I was like, okay, what can I do about this for her now? And so I actually went home. I created a Canva presentation for her to help her understand what her condition was and what the treatments were. And we recorded it so that she could listen back to it at a later date. And I remember thinking, I was like, dang, it would be cool if her doctor had videos of her explaining the condition in her own words, so that my mom could develop trust with that doctor rather than just a 10 minutes. And then she can use those videos to hopefully educate the public and not only the patients one-on-one. And that was one of the big impetus of the creation of MedStory.
Wow. A couple initial questions. Because I experienced this too. You go into a doctor's visit and you're standing in front of somebody that has decades potentially of very intensive training and education. And so it could absolutely be intimidating. So like as humans, sometimes you don't want to look stupid. So you do just nod and say, yes, I understand. But in this case, in a lot of cases, when I've done this, similarly, you leave there like trying to remember what they said. And now like they give some papers as well that highlight what the treatments are and diagnosis that I feel are templates that they give you because they probably know that this happens often. But what do you think is at the core of that as to why a lot of people can't just pause and ask questions? Do they feel pressured? Are they like overly intimidated? Do they not want to delay the doctor from getting to other patients, maybe thinking that somebody else is probably in a worse condition than me, so I don't want to hold them up? I'd love to hear your experience from what do you think are some of the root causes of that?
Yeah, there's a couple of factors. First is that idea of the white coat syndrome that it's actually documented. It's really cool that you go in and when you see a doctor, your blood pressure elevates. And it's amazing to see that our body has this physiological response where you leave the office and your blood pressure is totally normal. And it comes through expectation, exactly like you're saying, like these people are highly trained and you want to make sure that you're making good use of that time. The challenge being is twofold, is that doctor is trained off medical science, gets no training on how to actually communicate the science to the clinic. And now they are facing a healthcare system with an insurance system that has been decreasing reimbursement for the past 20 years, which means that they're getting paid less per patient that they see. And the only way to pay back their $250,000 to $500,000 worth of medical debt is to see more patients. So there's a squeeze. There's a squeeze right now of where doctors have less time with patients. And so they are forced to rush the patient through the visit. And the patient can feel that, and they don't get the opportunities to really get the answers that they want, which is a big problem.
No, I feel like the stories that get picked up in the media are more like almost demonizing the doctors for that experience. But at the same time, like you said, they have a $500,000 student loan that they have to pay off, or they're, like you said, they're being squeezed. So I'd love to hear that side of the story from the doctor's perspective. Like they have to see 30 to 40 people a day, I think is a metric you shared. Educate me and the listeners a bit on the evolution of kind of the healthcare system and why this is putting a lot of pressure on doctors.
Sure. So
In a couple minutes.
yeah, of course. It's very long and convoluted. But on average now, the average patient gets about 8 minutes with their doctor, which is a big problem. And it really came with the privatization of health insurance, right? The idea of health insurance is an incredible idea. Like we all need it to hopefully don't go bankrupt. But what happened is that as these insurance companies became privatized, they became publicly traded companies where they are no longer looking out for the best for the patient. They're looking at what's best for the shareholder. And what's best for the shareholder is how do we increase profit margins? Okay. And so when they said that, there are several systems that they have now put in place to help maximize their profit. And one of them was through the reimbursement decline. So we say, oh, you know what? You don't actually need this much money to see this patient. We're only going to, instead of $100, we're only going to pay you $80. And this has been a trend that we've seen for physicians, therapists, like all the healthcare system. It's been declining for over 20 years. Like people don't realize it. It's a very little percentage every year, but cumulatively, that's become a really big problem. And so you have the insurers who are paying for it, right? But then you have these hospitals and clinics who are also getting privatized because these investors are saying, wow, there's a ton of cash flow going through these things. Let's buy them so that the doctors don't own them anymore. Our investors will own them. And then they're saying, okay, how do we improve our profit margin? We order more tests. We build more insurance. We see more patients. And so it's a double-edged sword coming at each other. And at the end of the day, what's happening is it's actually burning out our doctors. Doctors are leaving the profession more than ever before, which is a huge problem, and it's impacting patient care. So we got a lot of work to do.
Yeah. I feel like and this is probably what I was raised on, that the privatization of things, especially with the negativity surrounding government, for example, is a positive thing. But it sounds like this has just been a negative thing over the past couple decades.
I wouldn't say, see, that's where this is a nuanced conversation, because with privatization and competition comes innovation. And there's a reason that the top medical therapies and pharmaceuticals come out of the United States, because that's where the money is. So we have access to the highest tech of the whole world. Now, here's the interesting thing, is that we do not, the match of the amount of technology we have doesn't match our outcomes. So if we compare cross-culturally across the world about the amount of money that the US spends on healthcare compared to our GDP, compared to other developed countries, we spend way more. And then when you compare the outcomes, we do way less. And so then you ask, I understand innovation is a good thing, but there needs to be some balance. And that balance is just not there right now.
And what are some of the outcomes that are highlighted in that are lacking and doing better in other countries?
There's a ton of metrics that you can look at, but life expectancy, but even more than life expectancy is your health span. So health span being of like, how long are you living where you're actually like independent, living your own life, rather than how some people, I've seen this unfortunately way too often. I've worked in like nursing homes where people are just kept alive for 10 years of their life, just living in a bed. Right. And so that's not what we're looking for. We're looking to expand the health of these people. And we just find that the other countries are doing better. Like when you look at happiness scores, when you look at cultural involvement, there's so many things to consider into it, but across the board, we don't do that well.
Yeah. No, I feel like my normal next question would be what is the solution, or what are some of the solutions, and where does MedStory come in? Yeah.
That's I spend so much time thinking about that.
Yeah.
And I don't know. The answer is I don't know, but I'm sure as hell willing to have the conversation to find out. Realistically, ideally, a hybrid model is great. For me, I believe that healthcare should be a right. I think that everyone should have it. And the fact that someone can become bankrupt because they've had a medical condition here, like that's a big problem. So you say, how do we fix that? How the other countries do it is they do it through a nationalized healthcare system. Now, when you say, oh, we're going to bring in a nationalized healthcare system into the United States, people immediately, alarms go on saying, no. We do things our own way. And so they're very resistant to that. So we need to find a way to counteract that. So the first thing, and a good thing to look at is, for example, Germany, is when someone goes to medical school, they're not leaving it with just $250,000 to $500,000 of debt. And that takes a tremendous amount of pressure off of them, right? If these doctors aren't coming in saying, I have to make up all this lost time, considering I've been making next to nothing. I am now in my 30s. I've got to pay off this debt. So they're going to want to grind and see more patients. And that's a big problem, right? And then what we need to do from there is we say, okay, how do we decrease the amount of medical debt that the patient has? And then how do we focus on keeping payment fair and distributed throughout the country, especially our rural areas? I don't know. When I'm thinking about solutions, there's so many different things that we can consider.
Yeah. It's a question that has been on my brain a lot too. And I feel like what I've been fighting with is, it comes down to almost a moral issue where you're like, if they nationalize things, that kind of forces people to pay maybe for things that they don't think they should be paying for. And it's just, a lot of times it does come down to money and what people think is their responsibility versus an individual's responsibility. And I think the individualistic society that we have, it challenges that a little bit than more collectivistic societies like in the Middle East and in Europe. It's an interesting one. Yeah.
I agree. Yeah. And it's something that I think we just got to spend time searching for and looking for solutions, but when it comes down to it is if we want to continue to be a country of opportunity, we need to make sure that our healthcare system is figured out.
Yeah. And then I feel like MedStory is really great because especially on the example that you shared with your mom on the patient side, if more and more stories are told about this experience that she had, because I feel like it's not, because again, that white coat syndrome that you mentioned, which I had not heard of before, but like people don't want to share that they had no idea what their doctor said, because like sometimes it's presented to you in a way that you're like expected to know it. And so if you don't know it, you feel like you look dumb and don't want to share that. So the fact that the MedStory provides a space where those stories could be told from both the doctor and the patient side. So the doctors could share a little bit about their experiences and some of the challenges they're facing, because doctors don't want like people to misunderstand a diagnosis or a treatment. They want people to have like fully acknowledge and understand what they're supposed to do. And people also want to fully acknowledge what they're supposed to do so they can get better. Yeah.
And you're absolutely right. And it's interesting how the landscape has actually changed from that, because we used to go to our doctors for information, but now with the advent of AI, we're going to go to them more educated than we've ever been before, right? We're going to have a pretty darn good idea of what's going on, which is crazy to think. And so now that we're not relying on them as heavily for their knowledge, it's more for their access and their experience. Right. And so I want to go there and I want to know really two main things is, number one, can you help me? And number two, have you done this before? Have you helped other people in my situation? And if I can go and see online, like that a story that you share that I can resonate with and say, wow, you know what? That sounds like someone like me. Immediately, the trust that I'm going to have with that provider is going to be so much heightened. The more I trust someone, the more likely I am to follow their instructions. And we know that the more we follow our instructions, the better the outcome will be.
Yeah. And the more comfortable I'll be like asking them a stupid question, like if I want to. Yeah. Yeah, absolutely. It creates an important space. Wow. I feel the same way with the advent of technology. In one example I could share, I'd love to hear your examples too, is I have our primary physician that we go to, and all of the tests I've ever taken that I've saved somewhere through the multiple doctors I've been through, I've uploaded and added to ChatGPT and entitled the I guess the file like biohacking. So all the results I have, I've stored them because there's no way that my current primary physician has that information or could access it. Again, another challenge in this system, but like using all those biomarkers and all the blood tests I've had and see how they progressed, like that is crazy useful information to have to share with them that they don't have. Like doctors don't know everything. And I feel like that's another misconception that people sometimes have. But yeah, that's definitely how I've used technology recently to see where I'm at, just from like lab tests and how they progress over time. So
yeah, I love how you're doing that. I love how people do that, where they'll put their tests in and it gives them the explanation. It's interesting. I've actually seen an evolution within ChatGPT of the way that it explains it to someone. At first, it would explain it in very technical terms. And I think that's the problem when a doctor does that as well. It goes over someone's head, or it sounds scary, or just, I don't know what the heck that means. Like I sound like I'm so broken. Whereas now I can hopefully do it in a less threatening way, so not to create panic. But I think that's where it's actually going to incredibly help and could potentially save the healthcare system.
Yeah. And I think it'll work both ways. Like the patient's more armed with better information and knows what questions to ask the doctor. And so, yeah, everyone's empowered and it's just more information share for sure.
Absolutely. Yeah, for sure. And like the main use cases right now is like, as far as they're using AI in healthcare, is OpenAI, and there's other platforms that now can just listen to the conversation that the doctor's having with the patient, automatically transcribe their note. Doctors right now spend about 35% of their day just charting. Like that's a third of their day documenting. If we can cut that down, that's huge. There's another one called Open Evidence, which basically houses all of the medical literature. So if I want to go and I want to find the most up-to-date evidence on something, I can research through this specific platform and it's going to give me a full breakdown. Once again, this took a lot of time for us to search through all this. Now we can get the results instantly, or the answers instantly. And then they're using it for diagnostics as well, to being like, oh, you know what? How do we speed up this diagnostic process so that we can get them on the right treatment plan? So it's really exciting.
It is. It is. I'm hopeful for it. Absolutely. But I'm on the tech side for sure of the house. So for MedStory Studio, I'd love to hear a little bit about the founding and how it's evolved since then, and what are some of the main activities that you're doing and focusing on?
Yeah, for sure. So it started as building out patient education portals for doctors. So basically a portal that the patient can go to, and then they can listen to their doctor talk about the condition and share some stories, things like that. And we found that it was really helpful for the patients. It was really nice to have them being able to hear their own doctor explain these conditions. It just enhanced that relationship between the two. But then, of course, these doctors, they want to increase their thought leadership, right? They want to get their name out there. And gone are the days where you can just get on and give a really technical answer and that's going to ever do well in the digital world. And so that's where we said, okay, how do we double down on what do we need to double down on? And it really comes down to is how do we combine the science with education and storytelling? And is that actually important? And it is. It's incredibly important. Like how it's evolved from just creating a portal to now we are launching podcasts with doctors where they can get on and share their stories and have really good conversations with their patients and then their colleagues as well. It's those conversations that are really going to help people feel involved and included. And that's the power of story. When we think about the importance of it, it comes down to we're moving in a world where it's becoming more digital. However, we need more human connection than ever before. And the way that we connect is sharing story. And I think that it should be done at all levels and all walks of life.
Yeah, especially after COVID. Yeah, it hasn't been easier to be a homebody and to stay indoors. Yeah. And what's to prevent, and probably like PII, but what's to prevent a patient from just like recording with video the doctor, like the whole engagement with the doctor? Has that been tried? Is that a no-no? I'd be surprised if that didn't happen often, even if people are like secretly recording the audio so they could like not to exploit anyone, just so they can remember what somebody's saying. I'd love to hear if you've seen that at all come up.
I don't hate that idea at all. And I've seen people do it where they want to record the conversation and take notes. And I personally see no problem with it. Unfortunately, this actually reminds me of the answer of how we fix healthcare, is that they put this into the policies that patients aren't allowed to do it. And so you say, why? Because we live in a very litigious society. Yeah. So another reason of why healthcare is so expensive is the amount of lawsuits that happen. Man. So these kind of lawsuits don't happen in other countries like this. And this is why now our physicians or the physician groups need these really hefty insurance policies just to protect them. And guess what? That's another layer on top that's going to get passed down to the people paying for it. When we're in these kind of things, it's multifactorial of what's going on. So unfortunately, hospitals and clinics, they typically don't allow you to record. And the biggest concern is that you would potentially record someone else in the clinic. And then that's where it becomes a HIPAA violation.
Gotcha. Okay. If you were to be able to snap your fingers and change like 1 to 3 things about the healthcare system today, what would be the initial areas that you'd love to see changed, and why?
I feel that it's interesting. We have high tech, high innovation areas, but then we also have some very antiquated systems. And so right now, because the healthcare system is so complex, implementing new technology can take time. And I would love for that time of adoption to decrease so it's easier for us to do, because we have so many powerful tools that we can't yet utilize yet just because we can't figure out how to put them into the current systems. So I think that's number one. Number two is we need to start asking ourselves the question, is that there is a little bit of a moral dilemma in the way that it's set up, right? Is that doctor will get paid based off their productivity, right? So like, for example, one model that a primary care practice will do is that a doctor, they say, okay, if you see this many patients this month, you get your base salary. But any patient beyond that, you get a bonus. You tell that to a new grad physician coming out that has all this debt, they're going to be like, I'm hitting that bonus. The only way to hit that bonus is to see more people. So I think we need to figure out a way to stop incentivizing them to decrease quality of care. And that's where they get the bad rap. But you can't blame them. They have all this debt and they're trying to support themselves as well. And I'm not saying majority, 99% of doctors went into the profession to help people. Any clinician, right? And they want to continue to do that, but they also want to support themselves.
What do you see as the future of Men's Story Studio? What are areas that you're continue working on? What are areas that you want to expand into?
Yeah. So really what we want to start doing is we want to start partnering with really the big organizations. So the American Medical Association, just the ones that are out there trying to advocate for evidence-based practice and really finding ways to say, okay, what's the evidence, but not, and then saying, what's the story that the evidence tells? And how do we tell that in the most creative way that allows someone to say, oh yes, I actually do care about this. This makes sense that I'm going to change the way that I do things. Because if we can do that and lead to a cultural shift where we can actually start being proactive in our care, that is going to take a tremendous amount of pressure off of our system. But
Yeah.
it's an uphill battle.
And then I feel like in order for that to scale to the other, I guess, more privatized companies, you have to show that it truly is a better, I don't know, like a better return, because ideally you'll need less massive insurance policies. You'll need doctors to not have to force so many people that they visit, and likely the treatment and it will be improved. So there'll be so many positive metrics potentially that hopefully it'll show that it is even worth it from a profitability perspective to have that approach. Unless you think it's not, and it's just like a moral like decision that people have to make, but hopefully it would. Yeah.
I think absolutely it's going to be more profitable for them because like it hopefully can cut down on waste, right? Where
Yep.
there's so much waste in the system right now that if we're just like, oh, what if imagine if we had a world where we took away all influencers that are like trying to scare people, and then they end up making them buy these crazy supplements or just go on these crazy plans or don't trust the doctor. Imagine if we got rid of all of them. Imagine if we got rid of all of them and then just said,
man.
oh, hey, here's what's going on. This is my opinion, but it's based off of what the evidence says. This isn't like an anecdotal thing of, I saw this one person, I had this one experience. Like, we put that information out to the world, allow the world to consume it. And I would be surprised if we don't start making some better choices.
Yeah.
So how do we do that? Is we need to empower the qualified professionals to start putting their message out there and not being scared to do it.
And what is evidence based, and why is it different or more important or better?
Yeah. So evidence based means that we are making decisions based off of quality research. And when we say quality research, there's different levels of research. Really, the top one being meta-analysis, which basically is a analysis of multiple studies that look at a very similar problem and saying, what's the consensus that these multiple studies have done? And the beauty of the scientific method is that in science, we're always trying to prove ourselves wrong, which is why we make a recommendation now that we may not make 10 years from now, because we learned something new. And it's this very interesting thing. Like, we're always trying to say, oh, how do we make it better? Or how could this be wrong? And that's where people can spin it into saying, look, they told us to do this. They were completely wrong about that. Whereas the supplement person has been saying this thing for years and years and years that hasn't been disproven because they don't have any research to back it. It's a very big problem.
You touched on something that I want to bring up here too, the advent of the influencers who don't have the credentials. I feel like the argument as to why they're influencers, which means they have large followings, it could partly be because of the excuse that they have their hands on ChatGPT now, so they could answer any question, that it levels the playing field of knowledge, for lack of a better explanation. And it's taking away, obviously, because if people are following influencers and who are saying the doctors aren't right, it's a very interesting position we're in. Why do you think that has happened? What parts have validity? Which parts do not? And how are like doctors, for example, handling that?
First of all, I'm all for people being critical, like in questioning things. We should. Healthy criticism is a very important thing. But the challenge is that they start making these really harmful claims that really, and that's when it goes down to, it's like, it's not based off evidence, it's based off of some theory that they've heard. And so it's a problem. And what they've gotten so good at it, or they've gotten much better than healthcare providers at, is they do it in a really entertaining way, in a really convincing way. And they say it with such confidence that you're like, wow, they must be telling the truth. And then
Yeah.
you don't realize that they're talking off of one experience that they've had, and they've never been able to duplicate or replicate that experience. Whereas there's doctors, I've seen 12,000 patients in my life that had this problem, and the trend that you're saying is not true.
Yeah.
So they need to learn how to get a little bit more effective in the communication so that they can really instill some change.
I feel like that is, and I don't know why I'm having this aha moment now, but a part of what you do too at Story Studio is help modernize the platforms that these doctors have, which I see it as like a fight against the influencers who are just spewing really bad information. So I think that's such an important thing that you're doing, because like doctors, they don't want to spend time knowing what sounds are trending on TikTok to get the algorithm to have their really important story or information shared. So what you're doing is so important for the doctors that don't have the specialties and things like that. Yeah.
Yeah, I appreciate that. Yeah, for sure. It's definitely not something but it's not something they want to do, but they're starting to understand the importance and the value of it, which is cool. And honestly, with today's political climate, and no matter your political beliefs, or you might take offense to this, but like the people that are running it and making these claims that are unfortunately unsubstantiated, like it's putting a lot of fear into people. For example, Tylenol causing autism, and it's being not true. It's actually, the cool thing is it's actually empowering a lot of doctors and a lot of healthcare providers. They're like, wait a minute, that's bullshit. And we need to step up and say something about that.
Yeah.
So it's actually a good time to be in this field and help them in that cause.
A couple of last questions I have for the people that are patients or are being influenced or targeted by a lot of information. What is some advice you could give people in making a decision? Is it do your own research? Are there areas where the research is more credible? But in this age of so much information, it's just overwhelming. So what would be some of your advice to people that are in that position?
So you mean if they're maybe watching someone's content or something like that?
Yep.
The first thing you want to do is see, what are they selling? So if they are selling supplements or lab testing, there's going to be an ulterior motive behind it. Whereas if they're just trying to put out good information, and yes, of course, it's still okay to sell, but what are they trying to sell? And I think going in with an open mind, don't assume just because they have an MD or a DO behind their name that what they say is true. That's how it was in the past. You've been like, oh, you're a doctor, whatever you say, I'm just going to believe it. Unfortunately, that's not the truth. Fortunately, I don't know. I like the healthy criticism or skepticism of it, but then advocate for yourself and do your own research, but just understand that when you're doing research, don't pull from a single place. So if you're only pulling from one news outlet, you are going to be getting, it's a self-fulfilling prophecy. You're just going to be getting information fed to you that you already believe in. Question your beliefs, look at the other opinion, the other side of the story, get a well-rounded approach, and then make an educated decision for yourself.
Yeah. Awesome. People that are listening, an audience that you're trying to connect with, what's the type of engagement that you look for at MedStory Studio?
Yeah, so right now we just want anyone in healthcare, right? If you're in healthcare and if you feel that you want to help fix the system and hopefully put out some public health information that is going to make the world a better place, then join our community. It's free to join. It's just medstorystudio.com. And like I said, we are just trying to we are building the world's greatest community of medical storytellers, with the idea of the more effectively that we can communicate it, the better we're going to be able to impact change.
Oh, Dr. Spencer, is there anything you want to leave us with before we wrap it up? I know we're a little bit over, so thank you for going over with us, but anything that we missed or that you want to end on?
No, just like, honestly, man, I appreciate you doing this podcast and sharing the stories of these people. You're doing amazing work, and it's a crazy time right now, but I just encourage people to double down on the human experience and the human connection, right? And don't be afraid. If you are experiencing something, don't be afraid to share it, because you can be incredibly surprised of how powerful it is, because all it takes is one person to hear that story and you can change their life. So I got your back.
Thank you so much, Dr. Spencer, for your time, and really honored to hear your story and to share it. And good luck to everything to you and MedStory Studio, and we'll be cheering for you over here for sure.
I appreciate that, man. Thanks for having me.
Thank you.